This is my journey. Inspired one story at a time, a library of leaders was created. It began as a journey to learn. As time went on, it began to grow. All it needed was a platform, and this podcast was created to listen, to inspire, to share. I am a storyteller, and this is my journey. Welcome to another episode of Profiles in Leadership. I'm your host, Steve Anderson, and this episode is brought to you by Silna Health. That's S-I-L-N-A, the premium front-end RCM company that leverages technology with a team of onshore insurance experts to handle benefit checks, eligibility checks, and prior authorizations. Finally, a vendor that you can trust, like a full-time employee that scales with your business. Just mention the Profiles in Leadership podcast to receive a free trial. Today, our guest is Joshua D'Angelo, who is a doctor of physical therapy and a board-certified orthopedic specialist who has co-founded and directed global organizations centered around improving access to healthcare and innovating healthcare delivery. Dr. D'Angelo co-founded MovementX, a movement health platform delivering high-quality physical therapy and personal training services whenever and wherever it is needed most. MovementX's mission is to help people move their best so that they can live their best. Dr. D'Angelo also co-founded Move Together, which is a 501c3 nonprofit organization whose mission is to increase access to quality rehab medicine around the corner and around the world. He served as Vice President and COO from its founding in 2015 through 2021. He is responsible for co-creating the first global physical therapy day of service, which has united over 20,000 physical therapy clinicians and staff from all 50 states and nearly 90 countries to give back to their communities. He has also been very active in APTA, the American Physical Therapy Association, since he was in PT school. In 2018, Dr. D'Angelo received APTA's Societal Impact Award and George Washington University's Distinguished Young Alumni Award. He is a previous recipient of the George Washington University's George Washington Award and APTA's Mary McMillan Scholarship, named after the physical therapy profession's founder. Dr. D'Angelo has spoken nationally and internationally on physical therapy, leadership, and global health. He currently serves as CEO of MovementX, as an adjunct faculty at the George Washington University's Doctor of Physical Therapy program, on the American Physical Therapy Association's Finance Committee, and on the Alumni Council of the Zell Lurie, did I say that right? Institute for Entrepreneurship at the University of Michigan. So Josh, welcome to the program. It's really great to have you on today.
And thanks so much for having me, Steve. It's a real pleasure and honor. And thinking about some of the other guests you have, I know I'm in some distinguished company here, so I really appreciate the opportunity.
Couldn't wait to have you on. And you actually were on way back at the beginning of this thing when I had Ifosa and you on as well. And that was actually in person in Seattle, which was kind of fun. But gosh, that was back almost 8 years ago, I think. So.
And I think we're on the top floor, a suite maybe at the top of your apartment complex, and overlooking Seattle. It's beautiful, beautiful day and a lot of fun memories.
Yeah, it was great. So let's just start with a little context. So tell us, kind of where you grew up, how you got interested in PT school, and just tell us a little bit about your journey.
Sure. Yeah, I'd be happy to. I grew up in Ann Arbor, Michigan, so home of the University of Michigan, and was really fortunate, kind of had an idyllic childhood where we could go out in the neighborhood, play with friends, play basketball all day after school. And so when I graduated, I actually went to the University of Michigan just around the corner. And I didn't really realize how much it had impacted me until I left, and I left for PT school. Growing up in Ann Arbor, you kind of take it for granted. You got a 100,000 person football stadium that's there. You got a nationally recognized academic institution. And it's kind of just expected when you grow up in that region that, yeah, you could go to Michigan if you do well enough. But when I left, when I came to Washington, D.C. for graduate school, a couple things that were interesting happened. One, everyone started saying, "Oh, you went to Michigan? That's a fantastic school." And so I appreciated where I grew up so much more and the education that I had. And the other piece of it is that I realized what an indelible mark the institution left on me. And there's a lot of moments that I think of, but I think the one most easily perhaps relatable is the football program. And we're coming off a national championship just a couple of years ago and still feeling pretty excited about that. And the thing that struck me most about that was the sense of community that Ann Arbor and Michigan had. The sense of community that has really inspired me to try to bring to every place that I've gone. Because Steve, when you walk into a football stadium, everyone wants the exact same thing to happen, right?
Yeah.
Everyone wants their team to win that football game. And for Michigan, that means that I got a block M, which is our logo. I got it on my chest, on my hat, even on my shoes and my socks. Some people in that stadium love that team so much that they have the block M tattooed on their body,
Oh,
and they
God.
will all do anything it takes to beat that team that's in front of them. And it's this concept of having 100,000 people all at your back, all rooting for the same thing to happen, that inspired me with this sense of community. And so I think one of the things that I found really meaningful about growing up there was learning what community means and how community can rally to support each other. And it's actually a notion and a philosophy that I took into my physical therapy career as well. And so as I came down to Washington, D.C. to go to graduate school, I immediately looked for opportunities to get involved with the local community. And if I think about a bit of physical therapy and the why that I went into it, just to get into that piece of the journey, I was actually not even on track to be a physical therapist at all. Knew I loved sports, was always playing sports growing up, but it actually wasn't until I experienced it a bit of myself to go that direction. I thought I was going to become a high school coach and a literature major, and I started out my PT, or I started out my undergraduate journey on that track. But when I was 18 years old, I was playing basketball with my brother in the driveway. And if you can envision this outside of our small house with the basketball hoop right in the driveway, I was backing down my brother, back up against his chest. And in my mind, I was going to do a pivot, fadeaway Michael Jordan shot, over him, sink it to win the game. But when I pivoted to my right foot and went to push off it, I felt this searing pain shoot across my back. And immediately in that moment, I was on the ground. So I'm on the ground, trouble getting up to my feet, immediately walk over to my bed. And that next week, I'm just miserable. Hurts to roll over, hurts to stand up. Even looking over my shoulder when I was driving was painful. And I really didn't get any relief from any medical professional I saw until I got to my physical therapist. And once
Mm.
I got there, I started to experience this immediate pain relief, not through medications, not through procedures, but through this incredible skill set that he had and this incredible care that he exuded. He used his hands and his heart and his mind and some simple exercise to guide me through the healing process. And I was planning to swim in college, and I still remember the first time that I dove back into the pool, swam to the other side, did a flip turn, and pushed off the wall without pain. And I thought to myself in that moment, wow, what my PT did for me, I would love to be able to do that for other people. And that really set me off on the physical therapy journey from there.
Yeah, yeah, that's amazing. So now you went to school at George Washington University, and then you became very active early, much earlier than I did in my career, and a lot of other people do. You became active in APTA, and actually, were you president of the student conclave nationally?
Yeah, I was president of the student assembly way
Student
back in
assembly, yeah.
2012, 2013. Yep.
Yeah, yeah. Yeah,
Yeah.
that's amazing. So was it just the school that kind of promoted that and promoted the idea of getting involved, or was there something that you discovered that you just wanted to be involved in a more, a bigger scale than just your small class at George Washington?
Yeah, when I applied to PT school, I actually applied to a number of different schools. I just threw in an application to George Washington University. I'd never even been to DC, but it seemed like a great program. So when I arrived in DC, I immediately fell in love with it. I came up the escalator on U Street, and there are all these beautiful murals on the wall depicting this wonderful diversity. And then interviewed with the faculty the next day, fell in love with the faculty, and something that struck me right away was how encouraging they were for us to not only learn the skill set, not only get involved in the local community, but also experience all that the industry had to offer. And part of that along the journey was getting involved with APTA. So they supported us my very first year to go down to CSM, Combined Sections meeting in New Orleans. Now you're going to take a 21, 22-year-old kid and say, "Hey, we'll help pay your way down to New Orleans." I'm going to take you up on that.
Yeah, that's a good
But
idea.
I think they knew what they were doing, because once I got down there, surrounded by the energy of everyone within the industry, found out more about the student assembly and how it represented the 25,000 plus PTs and PTA students. I thought, I have a passion. I have some ideas that I would love to pursue implementing. Maybe I can be of service to this organization. Maybe I can be of service to the rest of the PT, PTA students across the nation. So I ran for the board in 2012, was fortunate enough to be elected. And that was really the first experience where I think I started to figure out what I wanted to do with my career. And I actually didn't know what I wanted to do with my career. So I'll even revise that statement. I think I figured out with that experience who I wanted to be surrounded with, because on our student assembly board, we had, me and the nine other of just the most talented and passionate and dedicated people that I had ever been around. And I'd been fortunate to be part of some amazing teams, but this team was just incredible. And I just realized that I want to be surrounded by people like this on a daily basis. I don't care if it's in a hospital system, in an outpatient clinic, in the military, wherever it might be. I want to be surrounded by people like this. So I had this sense that something more was possible when you're surrounded by people who really care and really love what they do. So it was a transformative experience for me.
Well, you even took it to the next level. I mean, aren't some of those people in your company today that you've still, kept in contact with, obviously, and then brought into your Movement X company as you move forward?
Yeah, absolutely. So I co-founded MovementX with Keaton Ray, and Keaton's one of those people that anything she touches just gets better over time, and so it was so much fun to work with her that I pocketed her in the back of my brain after graduating. So that I would love to do something with this person in the future, even though she's in Portland, Oregon, and I'm in Washington, D.C. We're spread out across the country. Maybe something is possible. So certainly started thinking about that from day one.
Yeah. So you graduate from PT school. What was your first PT position then in the physical therapy world?
Yeah, so I graduated. I graduated, and I did something. Don't have many regrets in life, but maybe this is a small one of them, and I advise people differently now. But I graduated, had our PT school graduation on Friday. We had our School of Medicine and Health Sciences graduation on Saturday, and then we had our university-wide graduation on Sunday. And then I started working on that Monday, and so that was a fast turnaround. I advise people now take a week or two off, go travel the world a little bit, but went right into working. And I had a staff PT job just a couple blocks north of the White House, with in a really wonderful organization, small one owner outpatient clinic, just one clinic location. And it was really there where I, started to get the bread and butter of the PT world down. Didn't have anyone looking over my shoulder. And I also, on top of that, wanted to rekindle that feeling that I had before of working with these other talented people in a variety of ways. And so I started trying different things. I tried different continuing education programs. I tried DC chapter leadership. I became a delegate within the DC chapter Physical Therapy Association, and even started dabbling into the nonprofit space, going on a trip. And I was trying to figure out what that next thing might be for me. And I think it was that diversity of experiences that helped to usher me forward in my career and finding really what was the right fit. Because I was growing clinically, but I was still seeking something else.
Yeah. So you were kind of the mastermind behind Movement X, and you decided that you wanted to start this company. And from what I know, it's an innovative company in the sense it's not your traditional physical therapy business that you start. So tell us about how you started that, why you started it, and what is Movement X? How do you describe it?
Sure. Yeah. So as I was going through that process, I started to feel a little bit burnt out, to be honest with you, Steve. Even just a year in, less than a year out of school, I started to feel a little frustrated. I wasn't looking forward to patient care as much as I thought. And I fell into this opportunity to actually go to someone's home and treat on a cash basis, and I pretty quickly fell in love with that environment. I went from being in an environment where we're being told how many patients we need to see, how many units we need to bill, even what treatment we can and cannot do based on some what I found to be arbitrary insurance guidelines. And in this home-based cash pay environment, I realized that I could not direct my care based on everything else that is required. I could actually coordinate my care based on what I thought that patient needed. So if they
Mhm.
needed to be seen for 20 minutes, fine, that's great. Let's do a 20-minute session. Or if they need 90 minutes to slow down, we can do that. I wasn't restricted by the frequency expected. I wasn't restricted by how many visits were approved. I could truly provide the care that I thought was right for that particular patient. And I had a number of moments along this journey of treating these patients where it just proved to me over and over again that, hey, if my own mother was to get physical therapy care, this is the type of care I'd want her to get. This is the type of care that I can really see myself spreading my wings with, really learning from, really growing with. And that passion that I found must have shown because I started organically getting all of these referrals from not only one patient, but all of these patients' friends. And soon enough, one patient turned into five, turned into 10, and I was taking care of a whole community. And as I started to build that up, I started getting phone calls from other physical therapists. And the other PTs would say, hey, I hear about what you're doing. Can you teach me how to do it? And I'd say, sure, I'd be happy to teach you. I'm loving it. And by about the 10th call, I kind of hit myself in the head. I said, there must be something here.
Mhm.
PTs are seeking more. And simultaneously, I started getting more referrals for patients, and patients were also looking for something different. So when Keaton gave me a call and we had a similar conversation, we thought, hey, there's something that we could do, she could do in the gymnastics space. Keaton and I started talking and said, hey, we could each do our own respective businesses, or we could come together, create an ecosystem, an environment where we really empower other PTs to deliver this type of high quality care. And we could do that together. And that was really a conversation all the way back in 2016. And by that next month, September 2016, we had incorporated and gotten our start.
Yeah, that's amazing. So it started with you just doing some cash-based, home-based treatment, and so tell us, what does Movement X look like today?
Yeah.
How many people are involved? You have some other owners, I believe. So tell us a little bit about the structure and how it works nationally.
Yeah, absolutely. I'd be happy to. I have to tell you one story real quick. It's a fun
Sure.
little side story because back in 2016, technology is not where it was at today. I sound like
Yeah.
a veteran at this point. So, Keaton and I were looking for different technology solutions. And we're calling all these different EMR vendors. We need something to be able to schedule patients, take payment, coordinate our documentation, et cetera, et cetera. We couldn't find anything that fit the bill. So we made a blissful yet ignorant decision. And we said, let's build our own software. And so, Keaton and I were mocking up different designs of what the software can look like. We're wireframing different functionalities. We have these big sticky note post-it things that we're virtually showing each other. And then we take it to these different software engineering firms, these different development firms, and they're quoting us, Steve, at 100,000, $200,000.
Sure. Yeah.
And I'm like, I've only seen those numbers when it comes to student loans. Like, I'm not familiar with cash flow in
Yeah.
that amount.
Unfortunately, right? Yeah.
Yeah. And so we're so, we're frustrated. We're kind of down on our luck at that time. And around that time, so this is 2017, yeah, 2017, I end up going to World Confederation of PT conference, a WCPT conference in Cape Town, South Africa. And I was dating a girl at the time, my wife now, but just boyfriend, girlfriend at the time. And she said, you're going to South Africa? I'm coming with you. I'm going. I'm going to find a role there. So she goes to this volunteer program. And she first day walks into the volunteer program, and I get a phone call within a couple hours. And she goes, I just met this guy. He's also a volunteer at the program. He was sitting on a bunk bed when I walked in on the top bunk, and as legend tells it, he was coding on two computers at the same time. And it turns out that this guy is a software engineer, just graduated college in Canada, and he's traveling around the world and building his own company. And she goes, "You gotta talk to this guy." And I was
Wow.
like, you know what? Like we've talked to so many people now, they're quoting us crazy numbers. Like, I don't even want to talk to him. And she's like, no, trust me, you gotta talk to this guy. And so we get on the phone with him, pour our heart out to him, and he goes, I'm going to build your platform. and he offers to do it for pennies on the dollar compared to what all these other firms did. And so he builds the first iteration of our software. We launch it in 2017, and we were super grateful to him. Wonderful guy, has gone on to tremendous success. But we have grown now to the point from the initial launch of the software to now where we have 80 employees within MovementX. We're predominantly based here in the DC metropolitan area, but we're also in Portland, Oregon, Orange County, California, Research Triangle Park, North Carolina, and a few other locations. And what's been really neat is that original inspiration that I started with of being surrounded by dedicated and talented people. Because all of our operations are digital, we've been able to be really intentional with who we take and where we go. So that has enabled us to take these amazing physical therapists spread across the country and develop this really empowering community. And as Keaton and I really reflected on the why behind MovementX, where we've landed over time is we want to create an environment to help physical therapists thrive. There's so much talk about burnout in the profession, and we know that burnout affects us personally. There's so much great research to support that. Burnout makes it more likely that providers, medical providers, physical therapists even, will experience coronary heart disease, more likely to have headaches, more likely to even have suicidal ideations. We know that burnout affects family members too. Over 80% of physical therapists, or over 80% of providers who experience burnout say it personally affects their relationships with friends and with family. We know it affects the organization and system at large. Billions of dollars are wasted every single year just on preventable factors related to burnout. And so as we think about it, ultimately it comes and it affects the patients too, because you're seeing physical therapists, you're seeing providers who don't want to be at their job. And so for us, our goal is really to help to empower physical therapists to deliver care at their best. We have a belief in the company, empowered physical therapists will empower their patients, because we know that if we put the physical therapist in the right environment with the right tools, the right resources, right, the right environment to deliver care at their best, they're going to make magic happen with their patients. So it's really been a fun journey where it's spun into a really highly flexible model where we go to different homes, gyms, fitness studios, and have clinic locations, provide our physical therapists with flexible schedules and all the resources to be able to deliver care, and then allow them to do what they do best, which is to deliver care with full autonomy. So it's been a fun journey to see specifically providers go from a place where they're burnt out and frustrated to being totally reinvigorated by the skills that they're able to deliver their patients every day, and to see the outcomes that they're always seeking with their patients actually come to fruition.
So now, when you started, you said that you started out as cash-based treatment. Now, has that changed a little bit over the years? Is it 100% cash-based, or do you accept insurances and work with that community?
Yeah, absolutely, Steve. We've tried to diversify. I think there's this narrative, and I'd be curious on your perspective. There's this narrative in the industry that insurance is the enemy. And I actually don't think insurance is the enemy. I think it's the quality of care that it forces you to deliver that's the enemy. And
Yeah.
so I always tell people that, hey, if we could go in network tomorrow and maintain our treatment system, maintain our value system, I would do it in a heartbeat. And so we've tried to start experimenting with different ways that we can maintain our model and engage with different payers. So we have a few different verticals that we're starting to scale out more. So things like MBA and workers' comp, we found we're able to do direct to employer relationships, different partnerships where we go on site either with employers or different government funded entities. So we're trying to reduce the barriers there for patients while maintaining our value system. So the majority of what we do is absolutely still cash-based time of service, but we've been able to flex and identify ways we can innovate to deliver the same quality while changing the payer.
So let's just talk a little logistics for those who maybe are in the profession or wondering about this. So I'm a physical therapist and I'm going to come aboard with Movement X. I would assume that you're not going to provide me patients. I kind of have to find my own patients to a certain extent. And then I use your system that you described, your software system. And then do I handle the cash and the billing with the patient, or do you as a company do that?
Steve, the only thing that I want our providers to do is just focus on how to deliver the best care to their patients. And so, quite literally, everything else is handled for them. Now, I will say to your point, we do expect our physical therapists to market, to have an active role in marketing. And there's a number of reasons for that, but primarily because, especially in the out of network environment, where you go is going to determine the patient population that you see. And so, for example, if I'm really passionate about treating runners, I want you to go to the local running groups, right? The running community and spend time there because that's where you're going to build trust with that community. And then those patients are going to come see you. So we very, very much view patient generation as a partnership. We're going to do everything that we can on MovementX's side to help you secure patients. And at the same time, we expect you to be active in your marketing, especially as you're going through that initial caseload build. And what we found is that gets providers really invested in their growth and invested in their development and sharpening this really amazing skill set, which is their ability to communicate with people who don't know what physical therapists do and who physical therapists are. We talk about all the time in the profession how we have an identity crisis, right? People don't know what physical therapists do. So let's get out there. Let's get into the community. Let's educate them. Let's show them, right? And so that's a big piece of the why behind the marketing side. But yeah, Steve, you'd functionally get on our platform. You'd be matched up with a local team if we have the local team in place. That team is composed of about 5 to 8 physical therapists, maybe a personal trainer. And then we have the whole team work together to be able to develop that local geography. So we've gone from a much more individualistic kind of platform-based model to more of a one in which we're developing teams of people that are playing meaningful roles in the larger community. And it's been really fun to see what each team can do as well to innovate on the ground to serve their local community's needs.
So do you provide any marketing training or leadership development or clinical development? What do you do to help these people maintain the quality that you're after?
Yeah, absolutely. We're trying to do our best at all of the above. Granted, I know we're almost 10 years in now, but we still feel like we're pretty early in that journey in terms of how we help our providers. So right now, something that we're working on is a clinical mentorship pathway. If someone comes in earlier on their clinical journey, what does mentorship look like at MovementX? Just by the nature of business, we have open book finances and we share with everyone. As you know, during your time as CEO, you got to have money to keep running the business.
For
So we have
sure.
a belief that we operate on that profit is fuel for our business. And in order to get to become profitable, we need to have patients coming in the door. And so the first thing we really did was focus on marketing. So we have a ton of marketing trainings. Every single provider who comes in the door works one-on-one with a coach in addition to the team support that they have. So they're getting all the basics as it relates to marketing, all the structures we've developed over the years, all the branded materials that they need to go and get out in their local communities. We really try to make it as easy as possible while upskilling them on top of that. In addition to that, one really exciting thing that we're working on is and it's a major focus for the back half of the year. It's actually what we're renaming not a career ladder. We're going to call it a career climbing wall. We don't like the career ladder terminology because that implies one unilateral track up. Everyone takes that same track. We love the climbing wall metaphor because everyone's goal is the same, right? Everyone wants to get to the top, but I might need to take, 2 steps over to the left, 2 rungs over to the left, and then go up. You might want to go to the right and then go up. Some people are going to be zigzagging the entire way up, right? But let's all meet at the top. So what we're working on now is flushing out those different verticals and what those verticals look like. So we have an early one that's developing that is exactly what you allude to, leadership development. The clinical mentorship one is in motion, and in combination with that, the marketing one has been in motion for a while. And we want to talk about specialization too. As we get a more robust research in so many different domains, there's a lot of room for our clinicians to become experts in certain fields and certain domains. So we want to be able to help support and pursue that as well. The nuts and bolts is, hey, let's get patients, let's get in the door, let's get your caseload full, let's get you to the point where you really feel like you're thriving. A full caseload with us is only 20 sessions in a week. Each session is usually an hour, so we assume that with everything you put into it, it's going to take about 2 hours per session. So at 20 sessions per week, as providers get full, they start to feel busy. But as they refine, they also ask this really wonderful question, which is, hey, I'm feeling fulfilled from a clinical standpoint, from a caseload standpoint. What else can I do? How else can I contribute? And that for any manager, for any owner out there, should be a gift. Someone coming back saying, what else can I do to support and uplift this community? So we're painting out those verticals now.
So, and when you say that, what more can I do? Are you saying, can I treat more patients? Or are you saying, can I do more to help the organization as a whole?
Typically, the question is, hey, I feel fulfilled with I'm treating as many patients as I want. What
Okay.
else can I do to help the community as a whole? And I think the thing that underlies that question, Steve, and maybe you know from your experience as well, is I think there's a desire to continue learning. I think there's a desire for more growth that perhaps in a traditional environment, if all we're doing is seeing patients, it's an itch that we don't get a chance to scratch. There's just no time. So whether that's growth clinically or growth in volume of patients, sure, or growth from a leadership development standpoint, what is it that you want to learn? How do you want to diversify your day-to-day existence? If you look at more burnout research, one of the challenges with burnout is it's more likely to occur when you're doing the same thing all day, every day on repeat. And so, even though I think we're so fortunate that every patient, every single patient is different, every patient is unique, it's still the same part of our brain. We're still exercising that muscle over and over again. So, I'm a big believer that if we can diversify your day to day, you're going to stay more meaningfully engaged in the main thing as well, which is delivering quality care.
So tell us a little bit about what the structure of Movement X looks like. So you said you're the CEO, Keaton Ray is the COO, and what's the rest of your team look like? And do you see it continue to grow and add pieces to that team, or where are you at, and what do you think you're going to do in the future?
Yeah, absolutely. And I appreciate you giving a shout out to Keaton. We have a couple other amazing founding team members. So Scott McAfee moved from LA to DC to help us launch way back in 2018. He is our chief marketing officer, and he's a marketing guru. Steve, he told me from day one, he said Google's going to be our top referral source. And I said, Scott, I love you, but I don't see a world where people land on a website and pay $200 for a physical therapy session. And I'm happy to say that he has me wrong, that Google is our top referral source. He's a wizard with all things marketing. It's been really fun to watch his growth. And then Fred Gilbert, he's our chief people officer. If you know Fred, you love Fred. He's one of those people that just makes an instant connection with every single person he meets. And so he is the one who's, providing support and resources and monitoring, making sure every single provider's experience is great. He is also now overseeing a coaching program. So we have another awesome team member who's coaching every single provider who comes in the door. And then we have a wonderful team that supports every function from Mandy, who's recruiting new providers, bringing more talent to the organization, to Teresa, who's fielding every phone call we get, and Kelly, who's handling insurance. Jameson's doing marketing. So we really wanted to build a world-class team that could support our world-class providers. And we've been fortunate with that team to grow and grow pretty organically at that.
Yeah, yeah, that sounds amazing. So, when you look at this, like you said, you're almost 10 years out from the idea and you're doing well. What's your biggest aha, or what's your biggest in this leadership role? What did you discover that you didn't realize was out there?
Ooh, that's a great question, Steve. There have been so many discoveries along the way. You know, I think the biggest thing is slowing down, appreciating the growth that has been had, and also appreciating the challenges. I think early on in my leadership journey, man, I would get really high with the highs, really excited, really kind of low with the lows. But over the course of time, what I've learned to do is appreciate both. And I look back now, and we're fortunate again to have grown pretty significantly. But some of my favorite moments, they're in the unfinished basement of a 76-year-old woman that Scott and Fred were living with because that's all the rent we could afford at the time, right? That we happened to turn into our co-working space, with yellow walls and insulation falling out of the cracks and a pet mouse running around there. It's a pet mouse that we nicknamed Mojo in this space that we fondly call the dojo. And it's that, and it's appreciating the journey, the ups and downs of that journey, and everything that it brings, the lessons I think that we learn along the way. And for me, the thing that keeps me going is the providers and the stories that we hear. You know, just last week, just last week, we had this really meaningful moment. A provider shared on our internal communication line. He shared this story of, he said, I had a patient and I was in an in-network clinic and I was seeing her really frequently. And she was that type of patient who, whenever I saw her on my schedule, it would ruin my entire day. My mindset would be off. I'd be dreading that session. And every single time she came in, it would be the same conversation. And he said, much to my dismay, that patient followed me to MovementX. But he said, since coming into this model, our relationship has actually done a 180. And I now look forward to every session I have with her. She has become all of a sudden compliant with all of her exercises. And now we're really making meaningful progress. And I heard that story and I got curious, and I asked him why, what is so different about this model? And he said, I think the biggest thing is just having the time with the patient, having her felt like I could listen to her, right? Being able to build a more meaningful bond of trust when I'm not worried about all the other patients that I have. And so it's those stories that really keep me going every single day. And I talk to so many providers who are burnt out and they're frustrated and they're thinking of leaving the industry. And it keeps me inspired on a daily basis to know that, hey, we can help to create something better that's out there. Because we help to create a better environment for providers, all the patients that then find that compassionate care, that compassionate provider are going to benefit. So it's keeping that why in focus. It's appreciating the highs and lows. It's really leaning into the journey. Those are some of the major lessons that come to mind, but it's a great question, so I'll keep thinking on it too.
Okay. Well, the curse and the blessing of any for-profit company is money, right? So, I'm sure there's, and you can tell me what you want to here on this, but
Sure.
do you fund it just internally from the business you do or whatever? Have you looked at outside sources? How do you keep this thing rolling and accomplish what you have in mind? And is it possible to do it in the way you thought you were going to do it?
Yeah, absolutely. It's a great question, and it's a big question that's always on our mind. And we actually instituted open book finance meetings because we wanted to have a culture of transparency when it comes to money. And so, if anyone is curious about where our funds are going, we invite them into an orientation, and then on an ongoing basis, we invite them to our open book finance meetings. So we have one every month for 30 minutes, where everyone can see, hey, how did we perform last month? What do we spend our money on? What is our profit for that month? And then we get to engage in meaningful conversations. And I'll tell you, Steve, those meetings are some of the places we get the best ideas because everyone's so creatively thinking about how we can most effectively use our finances. But we've had a journey over the course of the years when it comes to that as well. We intentionally did not raise any money at the beginning because we didn't want to lose control of the business and we didn't want to get diluted. So first 5 years, we were working in the company and on the company, but we were providing care as physical therapists, the entire founding team, and we were not taking a salary. So a lot of sacrifice, a lot of long hours, the late nights went into those early years. In 2021, we actually had some advisors share that, hey, with all the pandemic loan opportunities that are happening, there's the cheapest capital you're ever gonna find out there. And so I had to educate myself on, first of all, what does cheap capital even mean and understand that. And then once we learned, we ended up taking out a small loan. And with that loan, it gave us the first opportunity to really reinvest in growth. And we were really intentional with how we wanted to invest the money because we never wanted to be in a place where we had to do layoffs or anything like that. And we utilized that money to grow. But I'll tell you what, those first few months of not being profitable, they were not comfortable at all. To date, we had made sure to maintain a slight profitability in the company, but as we're seeing that we're losing money, it was really scary and really challenging. And it helped us to develop our best practices in order to make sure that we were spending money in a really responsible way that was really well controlled. So we did that and we worked through the amount of funds that we wanted to for a few years, and we pocketed some rainy day funds, make sure we have an emergency savings. And then we crossed the bridge back into profitability. And for us, we asked the question, what do we want to do now? Do we want to hang into profitability or do we want to go raise a round of investment and potentially continue to accelerate our growth? So what we decided to do then was actually a little bit unique is we opened up an opportunity for our internal community to invest in MovementX. So we actually did a small crowd fund on a platform called WeFunder. We raised a little bit of funds from our internal community and a little bit of funds from external investors as well, a couple advisors that we came to know and love and really trust. And we decided to go back through that route. And so as of now, we're working back towards profitable again, and we're on track to be there on the timeline that we were looking for. And then we'll pose that question again, which is, hey, what's the next step? What do we want to do now to make sure that we're being responsible to everyone who's invested not only their money into this organization, but their heart and their time as well, so that we can continue to best serve our mission and best serve our people. And the last thing I'll finish with is as we were really thinking strategically about finances and instituting these open book finance meetings, we came up with a set of 6 fundamentals of finance. They're kind of rules, if you will. The first rule I already covered, which is profit is fuel for our mission. Another rule that I want to mention here is that we invest in our people, our processes, and our platform. And so the first one is the most important to me. I think that people are our greatest asset, our talent that we're bringing to the organization. So how do we really reinvest in them and their success? And part of the connective tissue here is what we talked about earlier as well, is reinvesting in these different opportunities for growth with our career climbing wall. How do we truly make it so that their experience here is so, so good that they just feel like they're fired up to come to work every single day? How do we really help to get them to that point of thriving? So yeah, we're now in the space where we're excited to continue to accelerate our growth, and we want to make sure that we're serving our people really well. I came up with this phrase, or maybe I heard it somewhere along the way, that as we get bigger, we want to feel smaller. As we get bigger, let's feel smaller. And so we're instituting a lot of practices to make sure that comes to fruition as well.
So now, do you and Keaton and the other people, the founding members or whatever, do you still treat patients, or are you just full-time running the business at this point?
It's funny with time to time, absolutely. There's a need to treat a patient. I raise my hand and say, "Put me in, coach. I'm ready to go." And
Yeah.
so just a couple of weeks ago, actually, we have a relationship with some local correctional facilities, and we didn't have everyone to cover. And so Keaton put on her scrubs, got in the correctional facility, and was there treating inmates. And so yeah, absolutely, when needed, we'll treat. We went through a period of time though where we started to pose the question. And I remember my CI told me this one time in PT school, actually. He said, and actually had another person tell me, but the both of them said that there's going to come a crossroads in your career where you have to choose what you want to be really good at. And you're going to either have to choose going into leadership, being a management, or a treating clinician. And young idealistic Josh in PT school said, "Watch me, I'm going to do both." But sure enough, they were right. And for me, it came down to how can I serve my team the best? How can I serve from my position most effectively? And how can I serve my patients most effectively? And there came a moment, I remember when this happened and who it happened with, but I was with a patient and I was physically with them, but I wasn't mentally with them. I was thinking about my team. I was thinking about the business. And in that moment, I knew I am not serving this patient well. Someone could probably serve them better to me. So that's when I made the commitment that, hey, I need to go full time with leading the company, make sure I can get my ducks in a row here, serve the company to the best of my abilities, keep my hands and dabble in treatment where needed, but at the same time, focus on how I can best serve. So yeah, for the most part, it's a long-winded answer to say, yeah, for the most part, I'm not treating too much. But man, do I miss it. What a special skill set it is. And I get to rekindle it from time to time, which is really fun.
Well, it reminds me, I had a similar decision to make, as you know, and it's yeah, it's really hard because you work so hard to be that, skilled, physical therapist, and you know that the more you do it, the better you get, and then to make this change. But when I did it, I also felt like I tell people all the time, like I've had 2 amazing careers. So I was a treating clinician at one point, and I loved it, and it was wonderful. And then when I left that and went into the management and leadership role, it's different and also very fulfilling and rewarding, but just very different. So yeah, I've been on that same train.
Yeah.
So now you're CEO and you're running this company, which takes a lot of time. And then I understand you just made it even more challenging by having twins at the first of the year, right? So uh, you're a dad with what 6-month-old boys, is that correct?
Two babies, not one baby, but two babies. Yeah, it's funny. So I think my wife and I talked about the idea of having twins maybe once. We said that won't happen. Doesn't run in the family. We're not using any
Yeah.
additional medication. We're fortunate to get pregnant organically. That's not going to happen. And sure enough, it did. And so yeah, we found out she was about 6 weeks pregnant. It was 3 a.m. in the ER. She was so sick, and the doctor comes in, the physician, and goes, "Well, I have some news for you." And we think, "Oh gosh, good news, bad news." And she says, there's two. And we said, what? There's two, and the only question I could muster at the time, Steve, I'll be honest, the only question I could muster was, can you promise me there's not three? Because two feels pretty overwhelming right now.
Yeah.
So there are
Okay.
two healthy baby boys, and yeah, it's been a joy, and it's been more of everything than I could ever imagine. It's been, more intense, the feelings of love and appreciation, more intense, the feelings of frustration, just why won't you stop crying, and more intense, the overall love that you have. And the thing that has really helped me do, I think, as a leader is I have been so much better at prioritizing my time because you have to. I want to be a present father. And I want to make sure that I'm really good in giving these kids as good of an upbringing as I was fortunate to have myself, and so I really want to be great as a parent. I really want to be great as a partner too. I don't want to lose that piece of me, that relationship that led us here in the first place. I want to be great as a professional as well. I still want to be really, really good at my job, and I want to be great as a person. I got to take care of myself to be able to do the rest. So I actually call those my four P's, and I'm trying to kind of roll around and figure out the right balance to play and the right way that I can be fully present in all of those at the right time. But parent, partner, professional, and personal is really the big thing I've been thinking about and how I prioritize my time.
Well, I can tell you for sure that this is going to happen, that you, no matter how great a leader you think you are now, you're going to become a better leader because you're going to have to use what you know and you're going to learn a lot raising those boys. So, congratulations on that.
Yeah.
I would be remiss if I didn't bring up kind of your role in your 501c3 nonprofit organization. So, are you still involved with that, or has it just been too much and you've moved on? Are you still in contact with EFOSA? Tell us a little bit about where you're at with that.
Yeah, absolutely. I appreciate you asking because it's one of the things that I think I'm most proud of and most excited about, not only for what we were able to accomplish, but for the continued potential that they have moving forward. And so, quick background of that, you mentioned PT Day of Service that we started way back in what was the first year, 2015, I think, which organically grew. We brought together tens of thousands of participants across, it grew to 92 countries, all 50 states in the United States over the course of a number of years, and is a really special initiative. And then I co-founded a nonprofit organization that was kind of a spin-off of that with Ifosa Guobadia. 501c3 moved together, and the mission was to increase access to quality rehab medicine around the corner and around the world. And we were actually fortunate and went down to Guatemala, started a couple physical therapy clinics down there, including one of them still going today, a number of years later. We're really proud of the growth that they've made. And in combination with that, although I stepped down in 2021, of course, I've been following their journey closely, wishing for their greatest success, following along all the amazing things they do. Just this past January, they took another group from MGH, their DPT program, along with a faculty member down to Guatemala to provide some local service. And so, yeah, the nonprofit continues to be active. I continue to be a big, big fan, and I hope that one day to get certainly back involved. As you know, it's just a matter of how do I prioritize my time and be the best leader I can to the commitments and responsibilities that I'm taking on. So really excited for their continued growth, and we'll certainly be rooting them on as time goes on for sure.
Well, this may seem like a funny question because I can feel your passion and your enthusiasm for the profession, but what is your future look like in this PT world? I mean, there's a lot of people that kind of, get frustrated and kind of doom and gloom and the glory days are over and all the kind of things we hear about. Are you bullish on the PT in the future? Tell us what your thoughts are.
Yeah, absolutely. I'm certainly bullish. I think there's a few reasons for that. Number one is Steve, look at the market we're in. There's not a silver wave of people coming that are 65 and older or turning 65 and older. They renamed it a silver tsunami. We have a responsibility to all of our adults getting older to be able to take care of them and to be there for them and to guide them and make sure we're not just extending, age in a number, but extending the quality of the years as well. So I think we're in a great market. In combination with that, people are becoming more health conscious than ever. They're becoming more aware, the public is, that they don't have to have surgery. They don't have to turn to opioids to get pain relief. And so we are so well positioned as an industry to be able to take more care and better care of our population than ever. Not to mention all the direct access laws we have now that enable us to get into our local communities and provide a meaningful service without a physician referral. So there's a lot of reasons from a market standpoint that I think we're really well positioned. Multiply that by the people. Every single day I'm meeting these amazing clinicians, these amazing providers who have high aspirations for their career, but not just for their career, for their patients, for the quality of care they want to deliver. And that passion and seeing them and seeing what they can do when they're in the right environment keeps me inspired on a daily basis. So if you multiply the market with the industry's position and the talent that we have as an industry, I think that we have a tremendous potential ahead. Now, that doesn't mean that we're not without our challenges. And I think we need to be realistic in how we view those challenges, how big they are, and in the success that we have had in addressing them in the past. And so I think without clear visibility, then we're living in not in a sense of reality, right? But with clear visibility into those challenges, I'm confident that there's so much we can do to address them, lower the barriers for care, lower the barriers for future providers, and then take the next step for this next generation that's coming into our profession. So absolutely, I think we have a great opportunity, but it's going to be up to us whether or not we seize it.
Yeah, yeah, that's awesome.
Yeah.
So, Josh, in anticipation of our discussion today, is there anything I haven't asked you or we haven't covered that you want to be sure and cover in our program here?
Sure, yeah, I would love to actually turn it back on you real quick if I can. Am I allowed to do that, Steve?
Sure,
Yeah.
why not?
Yeah. One thing I would love to hear is you've been doing this for a while. If we go back to the beginning of the conversation, we talk about that day sitting on the rooftop, maybe that suite in
Yeah,
Seattle. You're interviewing you folks. I mean, we had a great conversation. I'm gonna have to go back and listen to that.
yeah,
That'd be
it
neat.
was a good
Yeah.
conversation.
But it's been gosh, what was that, 2018, 2017? I don't know what year that was. It's been a few years since
Yeah.
you've been doing the podcast consistently. You've had some amazing guests. How has it transformed you as a podcast host, hearing all these different amazing stories and being able to have these conversations with these incredible individuals?
Well, it's an interesting question because a lot of people say, "Why do you do it?" It takes time. I'm not making any money on this. Why do you do it? And it's just the simple answer is because every single time I do an interview, I learned something. I learned something, and I'm a lifelong learner, and it's just like, oh my gosh, it's so amazing, and something that I've known my whole career, and then somebody says it in a different way that just really makes so much more sense or so much easier to describe to somebody else. And as you said, you meet amazing people. There are amazing people in this world, and I'm not to brag here, but I'm getting inundated by brokers trying to get their people on this podcast, and I've gotten a little bit of reputation now for, having good interviews and having a platform for people, and so I say no to way more than I say yes, but the quality is gotten better and better, and hopefully I'm a better interviewer and get better at what I'm doing, and the guests are great, so. The question is, I just love doing it. It's my passion thing. It's something I get up and look forward to doing. So, going strong, and I don't see any end in sight yet.
Yeah, that's fantastic. Well, thank you for sharing, and thank you for all you've done throughout the years. I think you gave me the time of day when I was just a passionate student, full of idealism. I remember I think we were at CSM in Las Vegas, and you sat down with me, and I had some questions for you, and you answered them. Some of your leadership anecdotes that I've heard through the years, I still use with my students at GW when I teach the adjunct class as an adjunct instructor, where we talk about entrepreneurship and leadership and management. And through it all, Steve, the humility that you carry yourself with really is it's a beacon of inspiration for me. So thank you for all you've done. I know all that we're doing at MovementX, it would not be possible if it wasn't for the efforts of all who have come before. So hopefully we can carry this torch for the industry and help it take that next step forward and leave it in a better place than we found it.
Well, thank you for saying that, but I can also say too that, as I met you when you were still a student, I have a motto that my motto is I'm never afraid to ask the question. And you were never afraid to ask for questions or ask for help. It didn't matter who it was or whatever. You just were a lifelong learner yourself, and you just came up and were willing to be vulnerable and ask the questions. So I think that shows in your growth.
Yeah.
So, Josh, and at this stage of the interview, I always ask my guests the same common question, and that question is, in relation to leadership, what is a pearl of wisdom that you could leave us with today?
Yeah, I appreciate that. I think I'll go back to part of what I'm learning and what I've been so focused on, especially since having the boys, is the time. What is the most effective and most meaningful and most impactful use of your time? And I've been asking people this about me to get more self-aware as well. I've been asking it about other people and trying to get every variation on the question, but what is your superpower? What's that unique thing that gets you up at bed? What's up from bed every morning? What's that unique thing that you think you can bring to the world? What's that piece of you that, if exposed to the world, is just going to flourish and grow so exponentially? And how do I multiply that by how I'm using my time? And so that was a question actually I asked my team. I look at my team and I think they're all capable of being in my seat and doing my role, having this quote unquote title. But what is the thing that I am uniquely bringing to this organization, and how can I amplify that to continue to accelerate us and make us even more productively different? So that's the big thing I've been thinking recently. The big pearl is how do I most effectively use my time, and how do I multiply that with what I uniquely bring to the world? And if we do that, and in combination with that, we focus on doing good for others, then I think we can leave a positive impact behind. But I'm still learning on that journey as well. And like you said, trying to be a lifelong learner, keep asking the question, keep being curious, and I've no doubt it'll lead you to not only a good end means, but also an enjoyable journey along the way.
Oh, well said. Well, Josh, this has been a real pleasure. I've been meaning to get you back on for a long time, so I'm glad we finally made it happen. You're doing great things with Movement X and all the things within our profession. So keep doing what you're doing. You have an amazing team. I think the world of them, and you're right. You surround yourself with the right people, and you use your gifts, and they use their gifts, and great things can happen. So. Great talking to you today. Can't wait to see what happens next with Movement X and all your people. So keep doing what you're doing, and so great to have you on today.
Appreciate you, Steve. It's a joy as always. Thanks so much for all that you do and for having me on. Thank you.
Okay, and well, I'm sure I'll see you down the road for sure. So
Can't
we'll
wait.
we'll be in touch. Okay, take care, Josh. Bye bye.
Thanks so much. Bye.
Thank you for listening to another episode of Profiles in Leadership. To listen to all my interviews, subscribe to Profiles in Leadership with Steve Anderson on Apple Podcasts, iTunes, and many other popular podcast platforms. Some of these interviews are on video, and you can search YouTube for Profiles in Leadership with Steve Anderson. You can also access the entire library of interviews on my website, orange.coaching.com, and that is orangetheword.coaching.com, and go to the Media Center and click on Podcasts or Video Gallery. You can also enter the website from pilpodcast.com.